Good afternoon, fellow professionals. My name is Natasha Hastings. I've been elected as the United States Secretary of Health for case study number 2. I want to start with what cases are looking like in the US today, what data has looked like from the beginning of this pandemic. You can see it around the beginning of March, numbers started to pick up. They hit their first peak, and then regulations kind of got lessened. They got relaxed, they got lifted. And everyone assumed because they've been flattening the curve for a few days that they were doing everything they should be doing, that they were handling it properly, although people were not wearing masks as often as they should have. As soon as restrictions became lighter, people began to see this problem as not as serious as it is. So that continued for a little while, and then as you can see, we have a new peak that was around July 17th. That was the highest recorded cases yet, nearing 75,000 cases in one day. Just the other day, the most recent data that I've collected for you is on the 3rd of August. It was floating just around 50,000 cases a day and around 60,000 cases a week. But these numbers are still uncontrolled and uncontrollable. Lowering restrictions lessens the public severity of the ongoing issue. I have some recommendations for what can be done for more of a long-term solution than what they're being seen as right now. My first recommendation, this one would only be temporary if enforced properly, would be the restriction of movement. There are 50 states in America, and there are no border closures, no national travel restrictions that have been given through the government at all, through Department of Health, through anyone, no national restriction of movement. International restrictions have been put in place. They've hit phase 4, but for national movement, people are free to go between California and New York and all up and down the country as much as they'd like without actually having checks or closures or any of that. Young people, the 1 in 5 young adults or people with bachelor's degrees have relocated. They're planning to, or they know someone that already has, due to the outbreak. People aren't financially capable of living on their own anymore at that age. People are moving back in with their parents. They are relocating to other students from their schools that have closed to seek study groups, new job opportunities, or lost jobs due to the pandemic. All of these things are influencing about 20% of young Americans to continuously relocate. While about 43 million young adults make up this population, that means approximately 8.6 million have already relocated. But that doesn't mean people have stopped moving. The impression being given that people can move freely has continued on even after their moves or their job changes. People are just traveling for fun now. People are going to Mexico for birthdays, the few countries that allow Americans. They are leaving the country, they're coming back. They are not quarantining themselves. Americans are visiting their families in other states. They are still relocating between states at the end of the summer for school. This isn't something that's going to change. Lifestyle has changed for everyone. Most businesses are mainly closed. Entertainment facilities aren't as accessible as they were before in big city spaces like New York and Florida and Los Angeles. So people are now, or especially parents, are looking for more of like a suburban lifestyle with their children. After having to stay home and teach them school and work from home, everything going remote provides the accessibility for them to move elsewhere for a more comfortable style of living where they might not be living as congested as they were before in whichever city setting they came from. Travel is discontinuous and the microbes have varying latency periods, so lowering restrictions only allows the opportunity for a new curve, a new peak. And the latency period for this virus is about 2 weeks. So when numbers start to go down in about a week and they lessen the restrictions, they're really not helping anyone. It just explodes again. My second recommendation is to maintain the closures of schools. Stay-at-home options are only partly effective. They will reduce transmission to some degree, but it's going to be increased by much more exponentially through allowing people to actually go back for in-person contact, instruction, things like that. There's about 80 million students, kinder through 12, whose parents do have to transport them to and from school every day. They run into various other opportunities of transmission along the way. and children are very highly resourceful as transmitting vectors for disease. We just had an incident in Georgia in Gwinnett County where 260 teachers a week before returning to school tested positive. They assumed that that's because this county has been the hardest hit in Georgia. So they continue to open up their schools just with this many less employees. The first day that people did return to schools, entire classes had to be put into quarantine due to one student testing positive. Parents are knowingly sending their sick children to school because they can't take care of them because they have to go to work. And this whole virus is not going to stop until people take it much more seriously than the value of a dollar. Here are some pictures from schools in this county. A student was actually suspended for having posted these until the school later, quote unquote, admitted that this student was looking out for the general well-being of the entire population. As you can see in these photos, not many students are wearing masks. I see about 4 students maximum wearing masks. The amount of students in these hallways does not allow social distancing whatsoever. Space restrictions are just impossible with this many people per space. There is no phased introduction of it. Everyone just came back at once. So this kind of environment is being brought home to the parents. The teachers are the most in danger for having to come in contact with so many students at a time. And it's just all around not a good idea. All instruction should remain online until this virus is handled. Until then, people will continue to senselessly die. My last recommendation for you is the reassessment of essential and non-essential businesses. I specifically mean to reevaluate childhood daycares as essential businesses. These are only essential businesses because Americans are being forced back into work. The new stimulus talks, the packages, the cuts on money, all of it is gearing for Americans to have to go back to work, to have to sacrifice themselves. And parents are knowingly dropping off their COVID positive children into these daycares because they're not really left with any other choice. They can't stay home and take care of their kids sometimes. Some jobs are not being offered online. People need to make money. The stimulus checks are not there to allow for people to take a break and to properly control the vectors. Another situation is takeout food. I don't understand how drive-through food is considered an essential business in states that are not considered food deserts, in states that have supermarkets within reach of most neighborhoods in most cities, to the point of people can stock up on goods for a week and go out once or twice a week to get goods, but they don't need to be going out in a drive-through every day, going through Jack in the Box, using fast food or quickly feeding their children every single day. Those places are also like an epicenter for transmission. Whether or not people are staying in their cars, the people working there might be asymptomatic. The people working there may not have even been tested properly. Food handling regulations are always something that is a burden to society in terms of transmission of diseases through even foodborne illnesses. COVID is known to remain on surfaces for a period of time, maybe 1 to 2 days, maybe a few hours. But if food is going from hand to hand and then hand to mouth, it is a direct route of transmission to allow people to interact with each other on a daily basis, multiple times a day, to get food. Extra provisions do need to be made for these food desert communities, like extra sanitary, limit on the amount of people per entry or people in a business at a time. Things do need to be done for those communities specifically, but only them. They should be the only ones allowed with fast food and gas stations and liquor stores and things. These are all of my references, and that is the end of my recommendations. I know a lot of people who are going to watch this video have taken part in some of these activities that I am suggesting to limit. I do think it is that serious. It is so serious that people have to stay home for a good long period of time to extend all of the latency periods of incubation for anyone else that might have come into infection, is infected, or is healing. That's all I have to offer, and I hope these things are taken seriously by the American public. Although it doesn't look like they're going to be anytime soon, I strongly, strongly suggest you look at other countries. and their statistics. Thank you.